All right, let's get into the conversation tonight. It is 20 minutes gone past 5. You are tuned in to Smooth Health here on Smooth 98.1. My name is Joy Oreye. Always a pleasure to be here with you. And on Smooth Health, as you know, we always try to share insights regarding your health. And today's not going to be any different. Today, however, I'm happy to have this conversation. And thankfully, I have with me the one and only Dr. Abiola Ajayi. He is the MD CEO of ROA Specialist Hospital. Yes, he's not in the studio, but he's joining me virtually. And I'm glad to have him all the same. So good evening, Dr. Ajayi, for I think this is officially New Year. So yes.
This is the first time, man. Happy
Yes.
New Year to you.
We're supposed to have had you on. So I in my mind, I had assumed that I'd had you on already. So that's where the whole mix is coming. I apologize for that. Anyways, yes,
First time with 2020.
yes. First time in 2026. No, you weren't the last person in 2025. Not that I'm thinking about it. Anyways, let's get into the conversation for tonight. Yes, 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 Lagos. We're going to be talking about antibiotics. You use them. Certain people say, oh, okay, that's their go-to once they have certain ailments. But going to touch on the abuse, the proper way to use them, and there's something that is of concern where antibiotics is concerned is concerned right now and has to do with the resistance. We've seen or we've heard where certain doctors say because certain people are misusing or abusing this medication, they are becoming resistant, and then high dosage needs to be used in certain instances. So hence why we're talking about it tonight. So I will let the good doctor um, give us a breakdown truly of what antibiotics are, what they're basically used for. I think we should start with the basic first before we get into how it's affecting people, why they use them, and all that good stuff. So,
Yeah, so antibiotics are a class of medicines and they're used to treat bacterial infections. So some of them are meant to kill bacteria or some of them prevent bacteria from multiplying. And that distinction we'll get into maybe a little bit later. But the key word is bacteria. So common bacterial infections are like pneumonia, urinary
okay.
tract infections or UTIs,
Mm-hmm.
typhoid. When it's confirmed typhoid, that's a bacterial. A lot of skin infections, ear infections, and blood
Right.
infections are typically bacterial, but they're not painkillers. They're not anti-inflammatories. They're not strong medicine for any sickness, and that's what I see a lot of Nigerians kind of. Oh, let me just buy. I don't feel well. Let me just buy the strongest antibiotic I can and flush my system. I actually saw people making this request in a pharmacy. I wasn't dressed in my scrubs. I was just observing. I was there for like 4 hours, and I saw multiple people come in and just ask, "Let me get one tablet of so
A
and
person.
so antibiotic. I just want to flush my system." And the clerk would sell it to him. Another one would just get 6 tablets, like just these random strong antibiotics, very short doses, just to flush the system. And it's beyond amazing. If you look at in 2019, that was probably the worst year. Almost 5 million people died because of this problem. So
My word.
it's not as small. The concept of antimicrobial or antibiotic resistance is a real one, and it takes millions of lives. The lowest amount of lives it took in the last 10 years is 1.5 million.
1.5. Let that sink in, Lagos. 1.5 million. That is a huge number, and that's very scary. Hence why you do not want to be going to, you don't want to go to a pharmacy, just take medication or just get a medication off of the counter and think that that's okay without getting proper, prescription from a doctor. But that is why we have Smooth Health here to help educate you what the on things you need to do and why you need to stop abusing medication. Now, I know that you've made mention of things that antibiotics are best used for, cold, flu, sore throats, this kind of things. Do they work
Um,
on?
Go
Okay,
ahead.
so you've highlighted a few of them. However, there's certain things that I've also come across or I've heard there are certain people to use them for. Um, UTIs and the likes. What is the
Mhm.
common mistake that people make once it is that they're making, say, for instance, it's been prescribed by a doctor? Okay, we know that we're trying to treat something. Say, like you mentioned, sore throat,
Sore
pneumonia,
throats, the flu.
yes, the
Yeah.
flu,
Mhm.
and things along those lines, and they're given the proper prescription to take. What are some of the common mistakes people make even after getting the proper prescription?
Yeah. The First of all, how are we sure that it's the proper prescription? Because if we're talking about antibiotics and things like flu and
Okay.
sore throats, a lot of those things are viral, and we very rarely do viral tests because they're expensive. They take a long time. So, but bacterial tests we can do. So, if somebody has a
Okay.
cold or body ache or flu-like symptoms or sore
Mm-hmm.
throat, you need to take a sample and make sure that it is bacterial. Then antibiotics will work. But for the majority of colds, they are viral, meaning that all you need to do is you don't use antibiotics. All you need to do is support the patient, and usually your body will take over. In rare cases, you use antivirals, which are a different class of medication. A way to
Okay.
make it simple is like pouring diesel fuel into a petrol car and expecting it to run the same. It doesn't make sense to use antibiotics
No.
for a viral infection because the toll of the antibiotics on your body makes things worse as well.
Okay. Now that example actually, I'm sure a lot of Nigerians will understand that. How is it that you're putting diesel into a petrol engine? That is a disaster waiting to happen. However, research shows that many Nigerians take antibiotics without even seeing a doctor. Why is this even a thing, and how risky is this?
It's extremely risky, and that's what contributes. Like I said, last 10 year, the high for 1 year was 5 million, anywhere from
Right.
1.5 to 5 worldwide, is because we keep making these mistakes. We just mentioned one: treating a viral illness with antibiotics is a mistake. Using the wrong antibiotic for an organism, and I see seasoned doctors make this mistake all the time.
Oh,
There's different classes of antibiotics. So and they're I could probably name 50 without getting tired. But there and
okay.
within those classes there are maybe 10 to 20 different drugs. So you have thousands of drugs that you have to choose from. You don't just take a strong antibiotic that's meant really for urinary tract type infections and use that for an upper respiratory tract. There's a gram negative organisms and gram positive organisms, and the antibiotics just don't work for them. So it's similar to the viral thing. If you use the wrong antibiotic for the wrong organism, you're going to just do more harm than good, and that happens all the time because people guess or they don't take samples, or they maybe not informed enough, you know. And if it's something serious, I saw a
Okay.
patient last week, sinus infection,
Okay.
had been on the wrong type of antibiotic. His face has started swelling, so they now brought him to see me. Face swelling, X-ray. I saw all this pus in there, and it had started tracking up towards his brain. So if he hadn't treated it within maybe 2 weeks, it would have entered the brain. And then now we're talking about a whole different situation where we need to cut his skull open,
I'm
all
trying to
of that.
suck.
So,
Mm.
and all of that's from taking the wrong antibiotic. It wasn't the right one.
See that conversation about even because you just made mention of a medical practitioner also be making errors whilst it is trying to prescribe. Well, that conversation we'll definitely have some other time, but not because that's even scary. the one thing you're thinking is, okay, I'm unwell. I need to go to the hospital. I need to see a doctor. Doctor has prescribed it, and it's not the right one I'm taking. Now that's cause for concern.
Yeah.
Well,
I see it in patient population as they get more educated, they start. I'm talking about my patients and other patients. They start asking for tests, or they start asking to see the results, or they start asking you, okay, what are you treating? And
okay.
I enjoy that. I think the more a more informed patient is a better patient in my book. But we still have some of the older
On
or
educate.
more
Okay.
stubborn, let me just use that word, doctors that don't want to explain what they're doing to their patients. But it's interesting to
They
say the
usually
least.
tell you, oh, it's for me to know and for you to just be the patient and we
Right.
administer the medication to you. But
Take the prescription to the pharmacy, swallow it, and don't ask questions.
that was then, not now.
I don't do that,
Well,
by the way.
Lagos. We're talking about antibiotic abuse and resistance here in Smooth Health, and I've got with me Dr. Abiola Ajayi. We will take a breather, but when we come back, we'll talk about some uh, uh, more about antibiotic resistance, why it is a problem, and what can be done to curb it. I hopefully stop it and end it, but we'll start with trying to curb it first before we find a permanent solution. But we'll take a breather, get back in, continue the conversation. Don't move a muscle, Lagos. Stay glued to your radio. That is a very, very scary situation, especially where a doctor is prescribing the wrong medication. That is
Unfortunately, it happens
complication.
more often. I have so many checks and balances in my system at ROA that it slows things down,
But
but
it's
it's to
better.
catch those kind of things, right? So people complain about waiting time for drugs because we look up. So my pharmacy nurse called me just yesterday. Doctor so and so wrote this drug for a pregnant woman. I said, change it to this. Don't give her that drug. And I had to call Doctor so and so and inform, hey, we don't use these for pregnant women. We have to look. It's constant. Not everybody is like me. I'm found out that I will still look up a drug if I used it 20 times in the last year. I'll still look it up
To
before I
find out if
prescribe
it's
it if it
still
is. Because things change. Things change. Medicine especially, the knowledge changes. What we believe was true. Look at the food pyramid. Have you seen what happened to the food pyramid? They turned it upside down,
it's not the
right?
way we grew up understanding the footprint.
But it,
It's different.
but it's the way I've been preaching for the last 2 years or 3 years now. It
Well,
finally
that's
come
why they say
around.
knowledge is power. With the right
Mhm.
knowledge, you won't be found wanting. All right, let's get back into the conversation. It is 33 minutes going to 5. Lagos, you are tuned into Smooth 98.1. This is Smooth Health, and my name is Joy Ure. I've got with me Dr. Abiola Ajayi, and today we are taking a look at understanding what antibiotic is, why certain people abuse it, and now we're going to be focusing on the resistance because some people hear the resistance or hear antibiotic resistance, but they don't even understand what it means. I'd like the doctor to help us break it down. What is antibiotic resistance? It's a medication. How?
The right. Sorry, I cut you off. I'm listening.
No, no, go ahead. Go ahead. But please, go ahead.
Antibiotic resistance is that I want to make it very simple. So you can have, let's say, a class of bacteria, Staphylococcus aureus, or staph, as most people say, right? So
Yeah.
you typically treat staph with penicillin-based bacteria. So you throw penicillin at this bacteria for a week. You come back later, there's zero of that staph left. But
Okay.
antibiotic resistance means that you have seen that same effect, you try it
Mm.
again, and now at the end of 1 week, half of the staff are still there, looking at you, and laughing at the penicillin. That's resistance. And and it means that a drug that was used to cure an infection can no longer cure that infection. And what people or a lot of us don't understand is that bacteria learn, and they can actually, which is
Oh.
why bacteria are somewhat intelligent. I have to say they're intelligent. Where if you don't wipe them out, for example,
Right.
there's strong ones and weak ones, just like humans, strong and weak humans. So when you start taking an antibiotic, the weak
Mhm.
bacteria will get wiped out quickly, but just some of the strong ones will survive, especially if you, as a human being, stop using the antibiotic when you feel better instead of taking it for the full course, which is what
Mm.
the majority of people do. 60% of people that take prescribed antibiotics do not finish the course, and you start feeling better. You start feeling better because the antibiotic has killed like maybe half of those bacteria were weak, so half of them are dead. You feel better, you stop it. But the strong ones now can witness the antibiotic without dying from it, and they will now code something in genetic code like DNA, RNA, called a plasmid, and it's instructions on how to defeat the antibiotic, and they will now send it out to the other bacteria, and so you'll just have this class of resistant bacteria. And antimicrobial or antibiotic resistance is a community issue. This is not a one-on-one issue because those bacteria will pass from that person to another person. And now that person is infected with resistant bacteria. And then it keeps going and going. That so can you imagine if you had typhoid that was improperly treated, it now became resistant to the most typical drug they use for treating typhoid starts with the letter C. So you now use that drug for somebody that has typhoid, they're having painful diarrhea, they're dehydrated, they're on admission, and the drug doesn't work. And things get worse and they die. You can die from typhoid enteritis. So that's how it happens.
Now that you paint a picture, it is scary. Yet we have a lot of individuals to just go to the pharmacy, just get medication off of the counter and take it without finishing the dosage. Hence why I also had to ask the question because I've seen where, oh, but I'm better. Do I necessarily have to finish this dosage? Uh, They'll just dump you one place.
Can you imagine having malaria, knowing you have malaria, taking antimalarials, and you still have malaria? That's resistance, and it's worse. You know, it's scary to think of. And when you start talking about using stronger and stronger antibiotics, a lot of those strong antibiotics can give you liver failure or kidney failure. These are not things that you want to take lightly. So it paints you into a corner where no option is a good option.
Ouch. Now that is cause for concern. Hence why I I've been seeing on social media where doctors have been complaining about antibiotic resistance and abuse and how it's causing concern for them because certain patients will come in, they're supposed to help them eradicate something, it's not working. The right dosage that they're supposed to use is not working. Hence, they're having to sometimes double, triple the dosage. And it's now that you explain that, I'm imagining that, and it is scary. Imagine taking anti-malaria medication and it's not having the effect, and I'm still there, all because I've tried to help myself.
Right?
So it's
Self medicate.
important. Self-medication. I know we've spoken about it before, and
Mm-hmm.
it's I believe sometime uh sometime in the near future we'll talk about that again as to why one wants to avoid self-medicating. We'll talk about that in the nearest future. But for the average person, are there clear signs to look out for to figure out, oh, okay, my body needs or I need an antibiotic, are there symptoms to look out for, or for them to determine it? Okay, so for instance, someone is having a cold or is having a cough, and I've seen that a lot where someone is just coughing. The next thing you're saying, "Oh, go and buy so and so, um, so medication." It's an antibiotic. I'm not going to mention the name as well, and that's what they do, as opposed to either taking proper rest or
Mhm.
finding what is causing the cough in itself. They just "Oh, go over the counter and this is what I want. I am having a cough. I know this is what I need to." How do you know that? So please, educators, are as regards antibiotic and what it is we need to do when we find ourselves in certain situations, especially for someone in the field I work in. My voice is my craft, right? And there are certain times where maybe there's a viral infection in the air. I've caught it. I'm down. I'm trying to make sure that my voice is back up, and I'm struggling. But the next thing you're hearing, "Oh, have you taken so and so medication?" Self-medicating. So what are we supposed to do in that instance?
The easiest way for me to help people is to give some red flags. And the typical viral infection is going to be about 3 days of you feeling
Okay.
sick. So if you have symptoms like severe symptoms that last longer than 3 days, or you have a high fever that lasts over 3 days, or even gets worse over 3 days, you more than likely need an antibiotic. But of course, when I say this every time, I mean see a doctor to get the right antibiotic, right? If you're having a cough and you're having breathing difficulty or chest pain, or you notice you have something called tachypnea, which is fast breathing, that may also be a sign that you may need an antibiotic and get a doctor to prescribe it. If you
Okay.
can't keep fluids down, so you're dehydrated already, but you keep vomiting uncontrollably, another one. Another very common one, especially for women, painful urination, and the painful urination now even gets up to your side, what we call the flank, like your sides on both sides, meaning
Mhm.
more than likely it's gotten into your kidney. Those are almost always bacterial infections. They need strong antibiotics. And I'll add the last one, children. If your
Mhm.
child is now feeding poorly, lethargic, meaning doesn't have energy, is not moving much, or you see fast breathing, or God forbid convulsions, you need to rush
Right.
them to the hospital. More than likely, you have a bacterial infection. In this area of the world, it could be for convulsions, bacterial or severe malaria.
Okay. So I'm going to ask this question before we yeah, time never is our friend on this program, so you have to bear with me. There are instances, and I'm raising this one because I've heard where doctors have said that certain individuals, especially the male folk, will have an ST. Well, they have urinary tract. No, not urine. Not they don't have UTI. They have sexually transmitted infection.
Infection or disease.
Yes, and then the first thing they're doing is going to the pharmacy and getting this medication, and just it's worked for me before. I'm going to get it again without going to see a doctor. Please educate the general public as to why that shouldn't be the case.
So for everything to make it simple again, for every body part or body area, your eye, your ear, your bladder, your rectum, there are probably 10,000 different bacteria that can cause an infection there. So an infection is not always an infection. You can get a urinary tract infection from 1,000 different bacteria, and you can't expect one antibiotic to work for all of them. So your
Okay.
symptoms may be the same. With the urinary tract infection, like you mentioned, you can have frequency, like
Mhm.
urinating a lot, waking up at night to urinate a lot, or
Mhm.
burning or painful urination. That could be caused by so many different bacteria, and you need to know the antibiotic that's going to work best for that type of infection. Usually, what I do is when I have somebody I know it's a UTI, I'll look at some things, clinical history, look at them, and if they're pregnant, non-pregnant, and I'll usually prescribe a particular medication, but I'll also take a urine sample and culture it. And we call them back in 24 hours and say, hey, you're on the right medication or we need to make a change. That's
Right.
extremely important.
Okay. That is very instructive. So please do not keep abusing antibiotics. If you have an emphasis on have, if you think you have a medical issue, always make sure that you go visit your doctor. There's a reason why the doctors are there in the first place. They have more knowledge, and they're always open to help you find what's best for you. And with that, we've come to the end of Smooth Health, sadly. But before I
So
let you
quickly,
go, yes, time flies when you're having great conversation, especially where health is concerned. What are the simple steps one can take to um, one, educate the people around them and protect themselves from, or at least reduce the abuse?
and I'll just go, maybe I'll give you my top three or four. The first one is don't use antibiotics for colds, kata, those kind of things. And this is, I learned that word when I came here, kata. But you want to really do supportive care, meaning you're going to sleep well, eat well,
Right.
drink plenty of water, rest, avoid alcohol and smoking, those kind of things.
Okay.
Never buy number two, never buy antibiotics because a friend recommended it. What has treated their illness may be the wrong one for your
Okay.
illness. And if a doctor prescribes it, take it as directed, the correct dose, the correct time, and complete all the tablets. There's a reason why they gave you that many.
Thank you so much, Dr. Abiola Ajayi. So, for anyone who's listening now and possibly could be shy trying to ask the questions, because I didn't get any questions today, so I'm wondering, um, maybe they would prefer to reach out to you personally and ask their questions. How can they reach out to you on your social media handles?
On social media, it's ROA, like my shirt says, ROA Specialist Hospital on all the ones that matter, YouTube, X, Instagram, Facebook. And we're at www.thetheroahospital@gmail.com and also .com. So that's our website. And you can call me directly. 0913 579 5108. 0913 579 5108. And I usually pick my phone. If
Emphasis
I'm not
on
in
I
Jersey,
pick my phone.
yeah, if I'm not, anytime.
Okay. Okay. Well, thank you so much. And Lagos, that's the much you can take. As always, take care of your health so it doesn't take care of you. There's still much more to come. If I were you, I would move a muscle. Stay glued to your radio.